Got it? Okay. Good evening, ladies and gentlemen. Can anybody identify this disease for me? 1 in 88 children will be diagnosed with this disease this year. And this disease, more kids will be diagnosed with this than AIDS, cancer, and diabetes combined. If you haven't guessed the answer by now, it's autism. The term autism derives from the Greek word autos, which means self, and was first coined in 1943 by psychiatrist Leo Kanner. It is important to know that autism falls under a broader spectrum category called autism spectrum disorder. It also includes Asperger's syndrome and pervasive developmental disorder, or PDD. By the end of the speech, you should know the causes for autism, signs to look for, and the treatments available. Now that we know a little bit about autism, it's time to learn what the possible causes of this disorder are. It should be clear that scientists have no true understanding of what the clear cause is of autism. However, they have some theories. The first one is maternal infections in the early stages of pregnancy, such as flu, chickenpox, anything like that can affect the infant's brain development while they're inside the womb. Next is mothers who are over 40 have the highest risk of giving birth to a child that is born with autism. And in 1988, there was a journal published linking childhood vaccines to autism. However, in 2010, this journal had to be retracted because of false claims and violation of research ethics. Now, you're thinking to yourself, I have a young child, what signs should I be looking for to see if they might have autism? Some of the signs that they're looking for begin to show up as young as 1 year old. However, no validated screening exists for these signs and symptoms until the infant is 16 months old. Research experts are looking for red flags or absolute indicators to indicate that the child has indeed autism. At 12 months, the first red flag comes up. There is no battling, no back and forth gestures, no pointing or showing by the infant. The next red flag is given at 16 months, where there's no single word spoken by the infant, no mama, dada, anything like that. And at 24 months, there are no two-word phrases being spoken by the infant. And the last red flag should be raised if at any time during their development stage, they have a loss of speech or babble at any age. Now you know what signs to look for your child. Now it's time to examine the possible treatments available for your child. The first type is applied behavior analysis, or ABA. This was developed in the 1960s using positive reinforcement to help foster positive learning by repeating appropriate actions over and over again, such as basic items such as eating, flushing the toilet, stuff like that. The next type of treatment method out there is the rapid prompting method, or RPM. This was developed by Soma, who has a child with severe autism who was almost mute. And she stated that she created this system because she feared that there were thousands of other kiddos out there that needed help learning. And how this works is the teacher states a few sentences about subject, and then she asks 2 questions, spelling and reading aloud each answer so as to stimulate left brain development in the child. The next way that the child can get treatment is through computer programming. They're designed to assist trained counselors and replace them when they're not able to be there. First type is ABA math, which uses the applied behavior analysis method to teach basic level math skills to the students. There's also click and read phonics available, which offers interactive lessons to help teach the students basic learning. And Mousetrap, which is another ABA-based training method that offers modules based upon food, animals, numbers, etc. It can be customized to anything that they need. And then there's drug treatments. These should be considered last resort, and at most times they should be directed towards the secondary symptoms that the patient is exhibiting, such as anxiety disorder, depression, bipolar, anything like that. So in conclusion, we have the causes of autism, the signs and symptoms that are out there, and the treatment methods. But before we go, I want to tell you a short story about my 2-year-old sister, about my sister Victoria. At the age of 2, she was diagnosed with autism. In her younger years, it was often a difficult time to handle with it. She had certain mannerisms. She wanted to haul around stacks of golden books with her, or buddies to the grocery store, stuff like that. But with training and help, we were able to improve that situation. And after years, I'm pleased to say that she's getting better every single day. She recently graduated high school while actively marching in the high school band, singing in the choir, and acting in the high school plays. All this makes me proud to say that she's my sister with or without autism.